We live in a world today where almost everyone has lost a loved one or a close friend to some disease that didn't have a good treatment. 1 in 5 people will develop cancer in their lifetimes. 1 out of 9 men and 1 out of 12 women will die from cancer. Today, 90% of drugs that go into clinical trials fail. We don't know how different genes and proteins interact. We believe that using technology, using data at scale, we might be able to decode the language of biology. And if we are successful in doing that, we will bring better medicines to patients faster and at lower cost. My name is Chris Gibson, and I'm the co-founder of Recursion. I've always been an early riser. You'll find me out and about the hills of Utah almost every morning because the world is pretty still. I love having a chance just to kind of take a moment and reflect before the craziness of the day starts. I never expected to start my own company. I was planning on being a surgeon, actually, and then the idea for Recursion grew out of my dissertation work at the University of Utah. I was frustrated by this slow, kind of one-at-a-time experimental approach. And when I saw how complex it was, how often those experiments failed, and how little progress it seemed like we made, it felt like there had to be a better way. In every one of our cells, we have about 20,000 genes that express about 400,000 proteins, and those proteins are having trillions of interactions inside each one of our cells, and we are made up of trillions of those cells. So you can imagine understanding how that all works is just extraordinarily complex.
If you ask the top biologists in our field, they'll say we probably understand 10 to 15% of biology. It's no wonder that 90% of medicines are failing. How are we going to find a medicine if we don't know what's driving the disease? That's where we started.
One of the analogies that I love is this idea of Google Maps. We're trying to do the same thing with biology. We want to know if somebody has a disease, we'll call that point A, and we want them to be healthy, we'll call that point B. What's the fastest route between those points? We started the company in 2013, and I think we've been a little bit lucky with our timing. With these powerful computational tools like AI, we're training algorithms that are learning how a cell looks and what that means about a disease. And what we do at Recursion is take millions of potential medicines and we add them to those cells and ask the question, do any of those potential medicines make the cells look healthy again? And if you look at 1 or 2 cells, you don't really see any patterns, but if you look at billions of cells, you start to notice patterns, and you'll start to notice things like people with a specific disease might have cells that are shaped in a different way. That gives us a clue. And instead of trying to reason our way through it, we're actually letting the biology give us the answer. And computer software is one of the things that helps us do that at scale. Welcome to our high-throughput phenomics lab, where we're doing millions of experiments every week, taking pictures of human cells to try and understand what's going wrong and right in biology. This is what we believe to be the world's largest concentration of high-throughput automated microscopes. Each one of these systems here is capable of taking hundreds of thousands of microscopic pictures every day. And all of that data is flowing up to the cloud and to our supercomputer through the cables that you see here. As of the last time we checked a couple years ago, we were moving more data per second through this platform than some of the leading online social streams. Yeah, if you look at this, this is actually all the little thumbnails from all the wells on one of those 1,536 well plates. If you look across these, each one of these is a different gene we've knocked out or a different drug that we've added. And if Mike actually clicks in on one here, we can actually zoom in on that particular well and look at all the cells that were in that well, all the different components of the cell. We have tens of petabytes of these images that we've generated over 10 years plus now. They're stored mostly in the cloud with GCP. We've built all the infrastructure and used infrastructure from our partners at Google to be able to basically look at all of this in pretty close to real time. And this way our scientists can keep up to speed with all of the happenings of the lab. And we can retrain our AI models constantly as we get new data. The rate that all of these tools, data storage, data analysis, GPUs, data centers have really come to our fingertips, it's really incredible. And it's making not only our job much easier, but the job of hundreds of other companies in our space and thousands of other companies in other industries dramatically, dramatically easier.
I'm Mike Jenin, and I'm a founding fellow here at Recursion. I've been doing drug discovery now for over 33 years. I had cancer when I was 15, and I'm fortunate that I had a treatable tumor. The drugs they gave me were rough drugs back in the day. They're still using the same drugs today, and that to me is kind of sad. They work, but we need to think about drug discovery in a different way in order to conquer these diseases. And I think that our platform and its ability to uncover novel biology, novel mechanisms, is going to allow that. All of us here are patients, or we love patients, or we're going to be a patient at some point in time in our lives. And to dedicate our lives to changing the way drugs are discovered, to changing the future of medicine, there's no greater pursuit that I can think of.
Using our technology, we are able to bring drugs towards the clinic in about half the time and 80% reduction in cost. We are working on dozens of different discrete drug programs at Recursion. We're hopeful that each one of these could become a new medicine.
One program that I'm really excited about is a disease called FAP. These patients have a lot of polyps in their colon that have 100% risk of becoming colorectal cancer. There are no medicines that are approved for this disease today. What we found was a molecule that could improve from disease to natural state. And we recently shared some data that showed that you can actually reduce the number of polyps by up to 80%.
That could become something meaningful. It'll give us a clue into how a bigger set of patients with colon cancer might actually be treated by drugs like this. I think AI is going to dramatically shift the way healthcare is delivered for all of us in the coming years. I think this is one of the most important impacts that AI can have on humanity. We're not going to need 15 years and 5,000 people to try and develop one medicine at a time. We'll be able to make individualized medicines that are right for you or for me and whatever exact disease that we have. I don't know whether we're 5 years away or 15 years away, but I believe that we will live in a world in our lifetimes where AI helps us not have to say goodbye to those loved ones early. And I think that's a pretty exciting future.